When it comes to children's mental health care here in Indiana, it can feel like families and even doctors are kind of stumbling in the dark,
Yeah.
like trying to find the light switch in a room you've never been in before. Where do you even begin to look for the right support? It's a massive problem, really.
It really is. And it seems like everyone wants to help, but actually getting that help can be incredibly complicated.
Exactly.
The path forward isn't clear.
It isn't. And that's why these reports from the Indiana chapter of the American Academy of Pediatrics, or INAAP, caught our attention.
Yeah.
Their work with the CARE program seems to be shining a much-needed spotlight on this really complex issue.
I think that's a great way to put it.
So in this deep dive, we're going deep on the CARE program, really trying to understand why it's become such a crucial resource for families who are often desperate for help.
Yeah.
And for the doctors who are trying their best to provide that support, we're going to look at how the program is actually saving money and why it holds so much promise for addressing the pediatric mental health crisis here in Indiana in the long term. We're looking at a whole series of INAP reports that take us from March of 2024 all the way to February of this year. So we're getting a really good timeline here.
That's great. And what's striking to me is how quickly this program came together. It was born out of an urgent need and developed through a partnership between INAAP and the Indiana Family and Social Services Administration.
The FSSA.
Exactly. And of course, with the help of COVID-19 relief funding, I mean, that really highlights just how urgent the situation was that they were trying to address.
Yeah. It's really a race against time in a lot of ways.
Yeah.
And one of the things that's really impressed me is how much of an impact the program has already had.
Oh, yeah.
The reports highlight that since 2023, the CARE program has helped over 960 families.
Wow.
Across 71 counties in Indiana.
That's amazing.
That's nearly 1,000 families getting actual support instead of just getting lost in the system.
Absolutely. And you have to think how many kids would have just fallen through the cracks without this program.
Or ended up in crisis.
Exactly. And that's the thing about the CARE program. It's not just about giving families a list of resources and saying good luck. They're actively working to make the process easier. They're tackling those barriers that can make it so difficult for parents to get the help they need for their kids.
I imagine those parents are already stressed out enough as it is.
Absolutely.
Dealing with a child who's struggling with mental health is already a huge burden.
Mm-hmm.
So having to navigate a complicated system on top of that,
it's incredibly difficult.
It's got to be overwhelming. And the reports actually give us some really specific examples of how the CARE program is making a difference in real-life situations.
Oh, that's great.
For instance, because CARE has already built these relationships with a network of mental health providers, families don't have to wait as long to get that first appointment.
Oh, that's huge.
Which can be absolutely crucial when a child is really in crisis.
Yeah.
Every minute counts in those situations.
Absolutely. And beyond that initial appointment, CARE really focuses on what they call enhanced care coordination. Basically making sure that everyone involved in the child's care is on the same page, the pediatrician, the therapist, maybe even the school counselor. They're all working together as a team.
And not just operating in their own little silos.
Exactly. It's a much more holistic approach. And I think that's really important for kids with complex needs.
Yeah. It sounds like this ongoing support and follow-up that the CARE team provides is also really key to keeping kids engaged in their treatment and making sure they actually benefit from it.
Yeah.
I mean, getting that first appointment is great, but it's only the first step.
Right. You've got to keep that momentum going.
Exactly. And for kids who are dealing with more than one issue at the same time, anxiety and ADHD, or maybe a mental health issue and a physical health issue, this integrated care approach is so important.
It is. It's about looking at the whole child, not just treating the symptoms in isolation. And the families are really noticing the difference.
They are. The reports say that the vast majority of families who've used the CARE program would recommend it to others. And I think that speaks volumes when parents are willing to put their name on it and say, this program helped my family. That's a powerful endorsement.
It really is. It shows that the program is meeting a real need in the community.
Yeah.
And it's not just about statistics. It's about real families getting the support they need.
And one thing that really stood out to me is the wide range of ages that the program serves. They're working with kids as young as 18 months all the way up to 22 years old.
Wow.
So they're not limiting themselves to any particular age group. And that's important because mental health challenges can emerge at any age, really.
It's true. And actually, the fact that a significant portion of their referrals are for very young children, that's really interesting.
How young are we talking?
Like 2 to 6 years old.
Yeah.
In one report, it was over 41% in December of 2024. And there's often a real gap in services for that age group.
Yeah. They're kind of in this in-between zone. They might have aged out of early intervention programs, but they're not quite ready for traditional community mental health services.
Exactly. So it's great to see that CARE is filling that gap.
And when you look at the types of services families are requesting through CARE, it really shows you the wide range of needs that are out there.
Yeah. What kind of things are we talking about?
Everything from assessments to figure out what's going on to medication management if it's needed.
Okay.
Outpatient therapy support, at-home support, at school, community-based services, individual therapy, family therapy counseling, mentoring, psychological evaluations, psychoeducational testing, you name it.
Wow. That's pretty comprehensive.
That is. They're really trying to cover all the bases. And it's not just the more common mental health issues either. The program is also providing support for families who are dealing with some really specific and often very sensitive challenges.
Oh, like what?
Like helping families navigate grief, supporting LGBTQIA+ youth, addressing issues around sexually harmful behavior, providing specialized help for kids with autism spectrum disorder, PTSD,
Wow.
kids in foster care, and even just general support and guidance for parents who are feeling overwhelmed.
It sounds like they're really trying to meet families where they are.
They are, and the reports share these really powerful anecdotes that really bring these challenges to life.
Oh, I'd love to hear one.
Well, there was one about a parent who felt that traditional outpatient therapy wasn't a good fit for their child,
Okay.
and they were specifically looking for a mentoring approach.
Interesting.
And then there are situations where the care team has to really work hard to find a different provider for a family.
Mm-hmm.
Maybe the initial provider wasn't a good fit, or maybe the family wasn't eligible for a program they were initially referred to.
Mm-hmm.
So the care team is constantly having to problem solve and adapt to the individual needs of each family.
It's definitely not a one-size-fits-all approach.
It isn't. And a big part of that personalized support comes from the care family navigators. These are the people who are really guiding families through the system.
Oh, wow. Okay.
They help families figure out what their needs are, research potential providers, make sure their insurance will cover the services, and then they follow up with families to make sure they're actually connecting with those services. It's like having a personal guide through this really complicated maze.
That's fantastic because I imagine for a lot of families it feels like they're just wandering around in the dark.
It does. And it's not just about finding a provider either. The program is actually advocating for families when they run into those roadblocks with insurance companies.
Which happens all the time.
All the time. Whether it's calling member services or navigating the prior authorization process, especially when an out-of-network provider might be the best option or even the only option. And it just shows you how difficult it is for families to access mental health care for their kids these days. It's not just about finding the right provider, it's about dealing with the insurance companies too.
It's a whole other layer of complexity.
It is. So we've talked a lot about how the CARE program is helping families. But what about the doctors? The primary care providers who are often the first point of contact for these families.
Right.
How is this program making their jobs a little bit easier?
Well, when you think about the sheer scale of the pediatric mental health crisis, the CARE program is a crucial referral resource for these primary care providers. They're often the ones who first hear a parent's concerns about their child's mental health. But they may not have the time or the expertise to really guide families through the process of finding the right mental health services.
So it's like they're able to say to the family, look, I know you're struggling with this.
Yes.
I don't have all the answers.
Right.
But there are people who do.
Exactly. And it's interesting because collaboration with primary care was a priority for CARE right from the beginning, which makes sense since the program is housed within the Indiana chapter of the American Academy of Pediatrics, so they're already connected to that world.
It's a natural fit.
It is. And they've even made the referral process really easy for doctors. They have this specific primary care provider referral form. So it's not a lot of extra work for the doctors.
And once the referral is made, the CARE program really takes over in terms of coordinating care. They're getting those release of information forms so they can talk to the child's primary care physician.
Okay.
And they're sending those mental health referral letters so everyone's in the loop.
That's great. It keeps the primary care provider involved.
It does. So the doctor knows what's going on with their patient's mental health care, which can really impact their overall medical care as well. And the reports actually include some feedback from doctors who have used the program, and they're saying things like they feel much more confident referring complex cases to care. They know that the families are going to get the support they need.
And it sounds like families might be more receptive to getting mental health support when the recommendation comes from a program like CARE rather than just from their pediatrician.
That's interesting. Why do you think that is?
Maybe it feels less personal, less like a judgment.
Yeah, like they're not being singled out.
Exactly. It's more like they're accessing a community resource.
That's a good point. And there's this really great quote in one of the reports from Dr. Aaron McLaughlin at Riley Developmental Medicine. And he talks about how hard it is for families in Indiana to find the right mental health resources on their own. And he says that CARE provides that crucial first step.
It's like a bridge.
It is. And he also talks about the importance of a clear recommendation from a trusted source. It can help families overcome that stigma that's still associated with mental health care.
It's like giving them permission to ask for help.
Exactly. And he really emphasizes how CARE is helping to improve timely access to care, which is so crucial when a child is struggling. The sooner they can get help, the better.
Absolutely. And that quote really highlights the value of the CARE program for physicians. It's giving them a reliable and trusted way to connect their patients with the mental health support they need.
It takes some of the burden off of them.
It does.
Yeah.
And it ultimately leads to better outcomes for the child and their family.
And the CARE program isn't just passively waiting for referrals to come in. They're actually going out and educating primary care providers about the program and how to talk to families about it.
Oh, that's great.
So they're not just providing a referral form. They're giving doctors the tools they need to have those sometimes difficult conversations with families about mental health. And they're also partnering with other organizations like the Be Happy program to really create a more comprehensive and accessible network of pediatric mental health services across the state. It's all about collaboration and building a more supportive system for families and for the professionals who serve them.
And that collaboration is so important, especially when you're dealing with a crisis like this.
Now let's talk about something that's on everyone's mind when it comes to healthcare these days: cost.
Yeah.
The reports actually address the cost savings that the CARE program is delivering. And we're not just talking about hypothetical numbers here. They're talking about real reductions in healthcare spending.
Really? That's amazing.
It is. And the data on avoided emergency room visits is really impressive. Based on the 960 families they've served, they estimate that the program has already saved about $1.55 million.
Wow. How did they come up with that number?
Well, use the example of a typical emergency room visit for a mental health crisis, which costs about $2,752.
Okay.
So if those 960 families had gone to the emergency room instead of using CARE, the total cost could have been over $2.6 million. And about $1.5 million of that could have been billed to Medicaid.
So taxpayers are saving money, too.
They are. And the point is that the CARE program is connecting families with the right care before they end up in crisis.
It's preventing those expensive emergency room visits.
Exactly. And it's not just about emergency room visits either. The reports also talk about the cost savings from avoiding inpatient psychiatric hospitalization.
Oh, right, because those can be really expensive.
They can. A stay in a psychiatric hospital for a child can easily cost over $10,000. So if CARE can help families get the support they need in the community, it can prevent those costly hospital stays.
So it's not just better for the child, it's better for the healthcare system as a whole.
Exactly. It's a win-win. And it makes you wonder about the long-term value of the CARE program and how we can make sure it's sustainable.
Right, because it's not a quick fix. It's about building a better system for the long haul.
It is. And the program is framed as an investment in the well-being of Indiana's young people, their families and their communities. And we know that supporting children's mental health has huge benefits down the road for their education, their careers, their relationships, their overall health.
And for society as a whole.
Absolutely. And the program is continuing to grow. They're serving more clients and reaching more counties. As of February 2025, they were operating in 70 counties.
That's great.
It is. But of course, the big question is, how do we make sure the program is sustainable? The initial COVID-19 relief funding won't last forever. So they're working on finding long-term funding partners. And they see this as a real opportunity for healthcare payers to get involved.
Because they're saving money in the long run.
Exactly. And the reports detail all the different things they're doing to secure funding. They're researching grants from all sorts of organizations.
Like what kind of organizations?
Like the Elevation Funding, Grants Tech TTCH, Grants the American Academy of Pediatrics itself, the Lilly Endowment, the Two Lilies Fund. They're also talking to state legislators and working with community partners to build support. They're really exploring every avenue.
That's really encouraging. It shows that they're committed to making this program work for the long haul.
They are. But they're also realistic about the challenges they face. Things like families not engaging with the program after that initial contact, communication issues within the system, insurance complexities, the shortage of mental health providers in some areas, and even just differences in parental beliefs about mental health care.
Those are all very real challenges.
It are. But the care team is working hard to address them. And one thing that's really interesting is that the types of referrals they're getting are becoming more and more complex.
What do you mean?
Well, it means they're reaching the kids who are the most vulnerable, the kids who have the most complex needs.
The kids who are falling through the cracks.
Exactly. And that really shows you how crucial this program is. It's filling a gap that no one else is filling. In a lot of ways, it's acting as a systems coordinator.
What do you mean by that?
Well, it's about making the most of all the different mental health resources that are already out there in the state by connecting families with the most appropriate and available providers. It's like they're taking this really fragmented system and making it work better for everyone.
It's like they're streamlining it.
Exactly. And the reports really drive home the need for this program when you look at the data on youth mental health outcomes in Indiana.
Oh, yeah. Those numbers are really concerning.
They are. The Indiana Youth Institute's Kids Count data book and the statistics on youth suicide are really alarming. And it shows you that this isn't just about saving money. It's about saving lives.
It's about giving kids a future.
It is. So to sum it all up, this deep dive into the INAAP reports has really highlighted the vital role that the CARE program is playing in Indiana. It's connecting families with the mental health services they need.
Yeah.
It's making life easier for both parents and doctors.
Right.
It's saving money. And it's a really important investment in the future of the state's youth.
I think that's a great summary.
And it really leaves us with this question. Knowing how successful and valuable this program is, how do we make sure it continues? How do we ensure its long-term stable funding so it can keep helping Indiana's children and families for years to come? And maybe even serve as a model for other states that are facing similar challenges.
It's a question worth asking.
It is.